วัสดีครับ Good afternoon everybody Lecture will be in English การบรรยายจะเป็นภาษาอังกฤษนะครับแต่ว่าสำหรับคนไทยนะฮะอันที่หนึ่งจะแปลสั้นๆนิดเดียวนะครับแต่ส่วนใหญ่ 80% เป็นภาษาอังกฤษแต่ถ้าใครมีคำถามถึงผมนะครับเรามีบูธหาไม่ยากเลยนะครับตัวผมยืนอยู่นะครับตรงนั้นเลยนะครับเดินไปทางนี้แล้วเดี๋ยวพอเสร็จการบรรยายแล้วเราจะไปตอบคำถามที่นั่นนะครับ I have my booth there you can see my pictures there so if you have any questions afterward we can talk over there as well so we're gonna start about cell therapy and in Thailand you know you will heard that everyone say that stem cell is used for that disease and this disease the problem is we talk about wellness is not sickness it means you are healthy how can you gonna regenerate and prolong your health it's not about okay when you get sick you use stem cell it's about you use it now while you still a little bit old but not too old the problems about Thailand and medical system everywhere is they call themselves healthcare business actually they are sick care business because if they are a healthcare business you go there with good health and they maintain the health of yours to be the same to be excellent shape they cannot they will provide you with a lot of allopathic drugs and complications will follow and that complication will cause trouble okay so hospital provide sick care not health care นั้นอันแรกที่จะบอกว่าไปหาหมอตามโรงพยาบาลสุขภาพอาจจะแย่ลงนะครับ so why I believe in cell therapy because I believe to achieve wellness we need to have proactive approach it has to be predictive when you do a medical checkup doctor should know that this lab test can predict disease how can we prevent it but these days the doctor only know oh you have high blood cholesterol let's give you drugs and drugs come with the side effect it kills your body and cells and organ and all that it has to be predictive and doctor have to know the way to prevent it how many doctors you know advise you about lifestyle right kind of food none never they always give you drugs because money makes the world go round and doctors always run the business someone like me I told my patients I need this one from you participate the patients is the best doctor for themselves you have to take care of yourself so any session when the patients come to see me they will hear about how to take good care of themselves finally a lot of hospitals advertise that oh our treatment is personalized is a lie if you see patients coming in 10 of them going out with the same medication personalized how could they going to be personalized I have to know what kind of career you have the risk of heavy metals the risk of office syndrome the risk what kind of food you eat do you exercise and the most important do you sleep well or not the doctors in Thailand and everywhere in the world stop asking about patients they are not proactive and we need proactive medicines to prevent disease because most disease are not accidental it can be preventable it's not accident it's not you get hit by the bus it's preventable the problem is doctors don't know how to prevent it สำหรับคนไทยนะครับการกินยาไม่ใช่การป้องกันโรคและอาจจะก่อโรคจากผลข้างเคียงของยาการดูแลตัวเองนั้นสำคัญที่สุดเราเรียกว่า proactive approach นะครับ and stem cell is one of those we have aging force every day we eat oxidative stress sugar inflammation toxins acidosis and importantly stress what happened is this aging force cause our cells to age including our own stem cells. These function stem cells make us grow old. I'm older than all of you here. It means my stem cells should be oldest. But because I rejuvenate my stem cells every year, and if it's possible every day, with the right kind of food and supplements, I know you get bored. One thing I could tell you, maybe I may get your attention if I tell you that I'm 64 years old. Now I get your attention now. How could I be 64? Because I try to take care of my own stem cells. And it's not about inject stem cell. It's about everything. Start with food, start with exercise, and right now I'm very good with stress management. I can think about my enemies or someone who think themselves is my enemies, someone who hurt me and I still said, oh, I can laugh at it. I can be happy about it. I can even thank them because the way you hurt me gave me today. The things that hurt me give me some lesson and I have today. So stress management is important. But today, I like to focus on two things about cell extract. I know you focus on that, you want to hear that, and hypoxic treatment นะครับสเต็มเซลล์ไม่ได้การรักษาสเต็มเซลล์ไม่ได้มีแต่ว่าฉีดนู่นฉีดนี่เรามีมานานแล้วเริ่มตั้งแต่การดูแลสุขภาพที่ดีเป็นจุดพื้นฐานนะครับรู้ไหมครับว่านะครับ in America you want to know who lived the longest check their zip code. It turned out that people who live in the state of Colorado will live longest because the high altitude, they live under the system they call hypoxia. Hypoxia. And in the studies, it showed that hypoxia stimulates stem cells. So what you're gonna do? Move to Bhutan, move to Colorado. No one can do that, right? It turns out that stem cells can be proliferate and grow better under hypoxic conditions. So I have the machine called hypoxic treatment. All I have to do is I don't have to go to Bhutan, I have to go to Okinawa for the blue zone area. The blue zone area is a high altitude area. I bring blue zone to my office. I have this machine that I can breathe in and out under oxygen. It's dropped from 20% down to 10%. And the studies show with low oxygen, your stem cell called mesenchymal stromal cell will divide it more. And I feel stronger. Actually, this machine has been used for the Olympic Games in the country that knows how and not in Thailand. In Germany, in Russia, the training of athletes before they go to Olympic Games, you need to tell your Japanese friend they want to do a sport association things, they need to have the machine called hypoxic machine. Because then the people who train under the hypoxia will be stronger, they can win the gold medal. As a matter of fact, in Germany, they have a room we call hypoxic room. We train under hypoxic conditions. Actually, I used to do a television show when I was younger, 15, 20 years ago. Yeah, I used to do that actually to run, do the treadmill under hypoxic condition. Oh my God. Yeah, but it make me fit and strong นะครับงั้นอันแรกเลยถ้าคุณอยู่ที่สูงออกซิเจนต่ำมันกระตุ้นสเต็มเซลล์ของคุณแล้วนะแต่ผมมีเครื่องที่จะกระตุ้นสเต็มเซลล์เห็นไหมยังไม่ต้องไปฉีดไม่ต้องไปทำอะไรเลยแค่หัดไปไต่เขาสูงๆอยู่ภูฐานแต่อย่าตกเขาลงมาตายนะ When we talk about stem cells from the past, it's always scientists' dream that we need to give something that make us younger. Yeah, what we need is someone from the young, right? So you can find a younger husband and you'll be younger, or yeah, go get younger husband. You easy. Men is easy than women because men can have a younger lady every day, but women cannot, you know. So eat them young. That's the rule. Okay, at least if you don't remember anything, remember the one rule to get stem cell. Eat young things. Okay. หากินเด็กคนไทยเราพูดประโยคนี้นะครับ so scientists try to find fertilized eggs embryo Chinese people have the youth elixirs called soft deer antler เขากวางอ่อนใช่ไหม but to ingest it if you take it by a mouth it will be digested and not absorbable so you need to do a liposome เขากวางอ่อน which I used to have okay soft deer antler fetal cell extract placenta extract and myself I inject myself with young blood I eat young people young blood plasma every year it's blood from the newborn baby placenta is the easiest one okay it's commercially available in Japan it contains a lot of hormones and studies show that it can stimulate stem cell increase telomere length you don't have to go and find telomere length increment supplements you can use placenta you see that's the source of young one okay we like them young who doesn't like young people oh young kid oh no god I'm in trouble now let's say let's eat the young one in the right way okay like placenta extract some will say oh it's unethical how could it be unethical when you get placenta you know what doctors do with it after the baby was delivered they throw placenta away so I recycle it I pick placenta from trash and make stem cell juice out of it okay so it's not ethical we talk about recycle now go to the period of you want to find stem cell and inject it to yourself we call transplantation okay it divides to autologous from yourself allogenic from your friends and xenogenic from different species ครับเพราะฉะนั้นเริ่มจากนอกจากไฮปอกเซียเราสามารถใช้รกสกัดสารสกัดจากรกและนอกจากนั้นถ้าเราจะปลูกถ่ายเซลล์มีอีก3คำนะครับออโตโลกัสของเราเองอะโลเจนิกของเพื่อนบ้านนะฮะของคนอื่นของใครไม่รู้แหละที่เป็นคนเหมือนเราและซีโนจากสัตว์ okay so we have 3 terms here all of us have stem cell throughout our life but when we older our stem cells getting older and older and it's turned out that when you old enough and you don't have stem cell to fix your body you die the studies show that people who have heart disease have less number of stem cells than people who are normal and healthy that's the rule the first one stem cell treatment the first one is come from the ancient Germany it's called fetal cells someone called live cell what they did is they used fetus of the sheep so when the mother like pregnant about 8 weeks they open sheep uterus take out the fetus the baby so the mother would not die though but the baby of course and they chop the baby and make stem cell juice and extract out of it this is German technique and is legal so if you go to Germany you can get this kind of live cell treatment okay and now there's certain clinic in Thailand that can deliver you this one you don't have to go German anymore because if you want to drink orange juice you don't need to eat the whole orange you can just squeeze the juice same thing right now some place in German in France and Switzerland they have this portion of youth the juice extract from sheep fetus okay sometimes they use it from horse and sometimes they use it from human but that's a secret okay because certain country they allow the abortions to be legal so why West okay so now you understand what is fetal stem cells okay it's the extract from the fetus usually from sheep okay and is done originally in Germany. You will hear a lot of conventional doctors in Thailand keep saying, they say that it can be used only bone marrow transplantation. It can be used. They talk like this for 15, 20, 30 years as if the stem cell technology has not moved advanced. And during this time, I have stem cell treatment for myself every year, and 15 years has passed. The doctors the same generation as me, now all very old or some die. And now, for surprisingly, the younger generation kept shouting at me, we use for bone marrow transplantation only. Listen to me. I'm not sick. I'm not going to wait to have stem cell treatment when I'm sick. When I start stem cell treatment on myself, I'm 50 years old. I don't have disease. But I want to keep my youth. What else I can do? Inject myself with formalin? I don't think so. So I use stem cell. And right now I'm at 64. And someone say that stem cell is dangerous. I don't have tells. My brain's still working. I'm still walking here and standing here and looking great. Why not? So it's not about bone marrow transplantation. It's about wellness. Wellness is not sickness. We want to provide wellness. We want to provide health care, not wait until they get sick and try to treat something that's too late. And it's turned out that within bone marrow, there's stem cells called MSC, mesenchymal stromal cells. I've been doing studies on this for 20 years, and I know what it is. It's the one that make me young นะครับเพราะฉะนั้นเวลาแพทยสภามาบอกว่าเขาใช้ในการปลูกถ่ายไขกระดูกไม่ผิดครับก็คนป่วยปลูกถ่ายกระดูกก็ไปปลูกถ่ายสเต็มเซลล์สิแต่คนไม่ป่วยมันไม่มีข้อบ่งชี้มันเป็นความเลือกของผมเลือกที่จะเสี่ยงบอกเป็นสิ่งของผมมีคนฉีดเลยเดี๋ยวเป็นมะเร็งฉีดแล้วเป็นนู่นเป็นนี่ฉันก็ฉีดมาเนี่ย15 ปีแล้วฉันก็ไม่เป็นอะไรทั้งนั้นนอกจากไม่ยอมแก่แล้วก็ไม่ยอมตายเนาะนะครับก็ยังยืนอยู่ตรงนี้ได้โอเค so MSC mesenchymal stromal cells okay it's been studied since year 1970s the name may change some people say it has to be called mesenchymal stem cells wrong actually all the organizations agree now the right name should be mesenchymal stromal cells not stem cell because it's not quite a true stem cell when you inject it will prevent inflammation. It will make you younger. It will not cause cancer like someone tried to scream at you. All of you here have mesenchymal stromal cells. It's part of the supportive system cells in everywhere in your organ. In the hair, if you don't have mesenchymal stem cell, you're not going to have hair like me. Your skin, if you don't have MSC, you won't have skin like me. It prevents you from getting old because it prevents inflammation. Okay, it's in the heart, it's in the brain, is everywhere, okay? And turns out that when we older, myself included, the number of MSC just decline, and a lot of studies, especially in animals, show that it can rejuvenate these animals. But anyway, when we try to use in human, it has to have a disease to start with. The mechanism of these stem cells is to prevent inflammation. And another question people always say, oh, it come from someone else. It shouldn't come from me. If it come from someone else, it will not match with me. It's unnecessary. HLA matching is not needed for MSC because MSC doesn't express any HLA. You don't need to do any matching. นะครับเพราะฉะนั้นการใช้ MSC ไม่จำเป็นต้อง match ไปก็ไม่เจอเพราะไม่มี HLA ให้ match หมอบางคนเพ้อเจ้อบอกว่าไปฉีดเซลล์แกะต้องแมทเซลล์แกะกับเซลล์คนฉันไม่ได้มีอะไรกับแกะฉันไม่คิดว่าฉันจะแมทกับแกะแล้วจะเจอหรอกมั่วใหญ่แล้วหมอสมัยนี้นะงั้น you don't have to match because it doesn't have anything to match for okay the mechanism pretty much is about reduce inflammation and it make this small thing that you may heard this before it's called EV extracellular vesicles that within this package of EV it will send the message across to reduce inflammation, to fix your cell, and to fix your body, and make you young. or at least continue to be young like me. This is the benefit of MSc. I'm use this exosome, the first one, I use it to make my own cosmetic. You can purchase it. I use this EV, put it in my cosmetic, and paint it on my face for 15 years. And I know that my aura can shine up to the back row without any problem. The MSc that I use come from water and jelly. Why? Because I don't have to take it from anyone else. When people say you should do autologous, you should use your own MSc, I did. When I first started at the time I was 48 years old, I went to the emergency room and asked them to draw my bone marrow and cultivate it into MSc. X the one who cultivated my bone marrow at the time. And turns out I inject that MSc to myself. It turns out that MSc come from the guy who's 48 years old at the time. Inject to the 48-year-old guy, I feel like 96. I mean, I'm already old. How come aging MSc can help me? So I changed. I said, I'm going to take MSc from the young one. I told you this rule before, right? And turns out that water and jelly, the tissue of umbilical cord is the easiest one. You don't have to kill anyone. The baby was born every day, and this umbilical cord was thrown away to the trash can every day. You just collect it, and you can cultivate healthy MSc from it. นะครับงั้นเดี๋ยวนี้เนี่ยการเลี้ยง MSc เนี่ยเลี้ยงมาจากเนื้อเยื่อสายสะดือไม่ใช่เลือดนะครับไอ้ที่เขารับเก็บเลือดไม่เกี่ยวต้องเป็นเนื้อเยื่อสายสะดือนะครับ I spent 10, 20, 30 millions baht to build this good company manufacturers. Why? Because I use it for myself. If I gonna die, I have to die first, not my patients, right? But I'm not dying. Instead, I became formalin man standing here. So that means okay. Okay, because I used it for 14 years and I don't feel anything. I don't feel sick. Okay? Unlike your doctor, they prescribe drugs to you. You ever ask them, doctor, when you prescribe cholesterol lowering drugs to me, are you taking it yourself? Most doctors will say, no. How can you trust the doctor who doesn't use the one that they prescribe to you? To me, every supplement I advise my patient, I will take it. And every sales therapy I advise my patients, I will do it. Okay? Because something happened, it happened to me first. I make sure my cells is cultivated under the situation called xeno-free. I don't use cheap blood, cow's blood, because I'm afraid of mad cow disease. Even the trypsinase things I will not use from pork. I use recombinant trypsins. So, and turns out that the rule is when someone want to use my cell, I say you have to tell it me in advance because I have to prepare it fresh. I cannot give you frozen. You know, guys know, fresh preparing food and frozen food and microwave, which one tastes better? Fresh preparing food, right, tastes better than microwave food. Same thing, why you want to use frozen microwave cells? You need to do it fresh. So you need to call me first, and then I make sure that every batch of cells are fresh. We have a vitality checking and everything. Okay. People always say it's about side effect. It's the rule. When the doctor prescribes you drug, he never tell you about side effect. I guarantee this cell has very minimal of side effect. Only one actually, I'm gonna tell you. นะฮะเพราะฉะนั้นการใช้เซลล์ที่บอกมีอันตรายผมก็ว่ามันไม่จริงผมใช้มา14 ปีแล้วนะฮะอันตรายคือทำให้ผมต้องอยู่อายุยืนขึ้นต้องหาเงินนานขึ้นมั้งนะฮะไม่แก่ตายนะฮะ The basic principle of this cell is to reduce inflammation. Inflammation is the cause of all NCD, aging disease, everything. Okay? Inflammation. And the study show that MSc is a cell that can stop inflammation better than NSAID, better than anything else. Okay? Because inflammation makes us old, and when we old, we have the situation called frailty and sarcopenia. I guarantee you, you look at your grandma, your grandfather, and some of your father are younger than me. And they have weak leg, bone. I know, because when I go to my alumni meeting, I walk like this. My friend walk like this. Not talk about brain as well. Finally, I have to stop talking to them because I feel like I'm talking to nobody. And that happened. Inflammation kill your cells slowly every single day. And this has happened because sarcopenia and frailty. There's numerous studies on MSC and wellness. They're going to show only one in terms of inflammation in frailty. We call Cactus trial. That it helps prevent inflammations and aging. And that could be why I'm still standing here. I can do a push-up for you, show you I can do a lot of things that almost impossible at my age. Talk about disease. When someone told you that, oh, they use it for bone marrow transplantation only, they don't even have a knowledge that right now the entire world accept MSC to be used from the situation called graft versus host disease. In this case, the patient who have graft versus host disease, 80% will die. So if you use something for something incurable disease or death for sure disease, it's not wrong, okay? ถ้าคนจะตายแล้วคุณใช้เซลล์บำบัดแล้วเขารอดตายแล้วมีใครมาบอกคุณว่าเชื่อถือไม่ได้ฟลุกถามคนที่เขากำลังจะตายแล้วเขารอดตายเขาเชื่อไหมฮะเขาจะเชื่อหมอแพทยสภาหรือเขาจะเชื่อหมอที่รักษาเขาคุณอาจจะเคยได้ยินว่าโรคไตวายรักษาไม่ได้ผมก็เชื่อว่าบางคนรักษาไม่ได้แต่บังเอิญรักษาได้มา 50% แล้วมันคงไม่ฟลุกมั้งใช่ไหมครับ It's about you and your patients. It starts by something called proactive. Proactive means you care about your patients. You plan for your patients. Not just about the rules, and it's not about guidelines. First of all, you are the doctor. You can be a doctor if you cannot take a look at the patient in his eye and tell that I want to help you. I told you about the side effect of MSC. And this is the one that most clinics out there don't know. It's called thrombosis and embolization. MSC, when you inject through IV fluid, can stimulate thrombosis. We call instant but mediated inflammatory reaction. It can cause blood clot and could be dangerous. So before you test or inject for MSC, the rule from me, but not other clinic, they will not check for D-dimer, but my patients before MSC treatment, you need to test for D-dimer to make sure it's normal, there's no blood clot in your system, okay? It's found high D-dimer testing is found about 30% in Thai populations, especially after the COVID. After COVID vaccination, people have blood clot in your system and you don't even know. อยากจะขอให้ทุกคนในห้องนี้ไปหัดตรวจดีไดเมอร์คุณเปียกไปตรวจซะบ้างเราไม่รู้เราเดินอยู่เราตายเส้นเลือดอุดตันเพราะว่าเรามีก้อนเลือดอยู่ในตัวเราซึ่งพบหนึ่งจากการกินของทอดทั้งทุกวี่ทุกวันกินไขมันสัตว์บกขาหมูสามชั้นหมูกรอบแต่ส่วนหนึ่งมาจากโควิดและวัคซีนโควิดนะครับซึ่งพวกคุณไม่เคยตรวจเลยโอเค So when you inject MSC, it can aggravate the situation, so make sure you test it first, okay, before you do MSC. Actually, we talk about cell therapy. The most common one is not the IV one for wellness. It's called adipose-derived MSC, and we use for face. We can transfer fat from the belly to the face and use it instead of filler, okay. We call autologous adipose tissue transfer. A lot of good clinic and good hands doctor, Korean included, use this. And they already use stem cell treatment for the face, okay? MSC itself is fibroblast. Fibroblast is a cell that stimulates collagen นะครับ MSC คือไฟโบบลาสต์ที่สร้างคอลลาเจนคุณนั่งกินคอลลาเจนเซลล์ต้องเอาคอลลาเจนไปสร้างเป็นคอลลาเจนที่หน้าให้คุณถ้าคุณไม่มีเซลล์คุณก็หน้าเหี่ยวต่อไปจะกินคอลลาเจนให้ตายก็ไม่ได้ประโยชน์ You need these cells to make up for collagen. It's called fibroblast. Okay, fibroblasts make collagen to make your skin still go up against gravity. And this is a technology award-winning technology from Siriraj Hospital. It's called autologous fibroblast injection. It's not cheap, okay, but it's working. You biopsy the skin behind your ears, you cultivate it into mesenchymal fibroblasts, and then you inject back to your face. The result can last for a year. There's a studies, that's award-winning study from Siriraj Hospital to show that compared to fillers group, it lasts only 1 month. But if you use MSC, the face plumpness and lift up thing will last for a year. The picture doesn't say a word as much as here the sample of autologous fibroblast injections. Look at my face. Okay, I have to be a presenter for my own. So what is pros and cons? There's a good thing about cell therapy if you know the right one to do, if you have knowledge. The problem, people use it for commercial purpose. They don't even have a real knowledge. They just talk and talk. They don't even care to listen to me, and they just talk and sell product. And that is a problem. There's only good things about cell therapy if you know how to use it and how to make it work. We wonder about, what the Thai medical institutions gonna say. And we forgot 2 rules. One rule is constitutional right. We have the right to choose what kind of treatment we're gonna use it for ourselves. And compounding pharmacies say it's between you and your doctor and no one else. But you cannot advertise. It's between you and your patients and you or your doctor, and you are the one who choose. Don't let anyone try to fool you. Use stem cell. I never did. Actually, my patients have to come hands and knees and beg me that I want to use stem cell. I say, no, you're too fat. You never get the right kind of food. You don't exercise. I'm not going to give you stem cell. It's useless. A waste product. Go bye-bye. I don't try to sell anything to people who are not ready to make a difference for themselves. I have to thank stem cell technology. Someone asked me, doctor, you are so successful in business. You can stop being a doctor and only run business. Why? I have more patients than anyone in Thailand, 2,000 plus. Why you still maintain being a doctor? My answer is, because my patients is my teacher. I have today. I learn everything from them. I have today because of them. I'm not going to stop taking care of them. So I'm here to make a difference. I don't want in stem cell so I can look young and laugh at you. You see, I look young. I want stem cell so I can continue my lifelong dream, which is almost impossible dream, to make everyone, not in Thailand only, right now I'm speak globally, make everyone knows how to be the good doctor from themselves. Because right now I know medical system is corrupted, and medical system is no longer about healthcare. It's about making money. It's about sick care. We cannot be hopeless, because the most important people in this room is you. You, the one who can make a difference. Start by make a difference in yourself. ขอบคุณครับ ขอบคุณมากครับ Thank you so much.
ขอบคุณค่ะ ขอบคุณนะคะอาจารย์ด้วยนะคะ Okay, thank you very much. Please remain on stage. เพื่อที่จะรับของที่ระลึกนะคะจากท่านผู้บริหารแทนคำขอบคุณค่ะ So I would like to take the opportunity once again to invite the President of Health Education and Economics Thailand Company Limited, Dr. Prathana, to remain on stage to receive a token of appreciation by the Chief Executive Officer of PMG Corporation Company Limited. A round of applause to คุณณรินทร์ทิพย์วิริยะบัณฑิตกุลค่ะเซสชั่นเมื่อสักครู่นี้นะคะเรื่องของเซลล์เทอราปีแล้วก็ longevity นะคะเกี่ยวกับการแพทย์ที่มีการพัฒนานะคะเพิ่มไปอีกขั้นหนึ่งนะคะสำหรับการที่จะใช้เซลล์เทอราปีนะคะมาช่วยในเรื่องของการป้องกันนะคะความเสื่อมการอักเสบ inflammation ในร่างกายก่อนที่จะเกิดเป็นโรคร้ายแรงนะคะเพราะฉะนั้น นะคะก่อนป่วยเราป้องกันไว้ดีกว่าแก้นะคะที่สำคัญนะคะขอเชิญผู้บริหารเพิ่มเติมนะคะเดี๋ยวถ่ายภาพที่บริเวณด้านหน้าเวทีค่ะวันนี้นะคะกับเซลล์เทอราปีนะคะก็ช่วยเรื่องของการซ่อมแซมนะคะการสร้างใหม่แล้วก็ช่วยในเรื่องของการปรับสมดุลด้วยนั่นเองนะคะขอเสียงปรบมืออีกครั้งหนึ่งให้กับท่านอาจารย์ด้วยค่ะวันนี้